What are your sort of recommended tools, books, resources? What do you give people, I guess virtually, to kind of help them with this stuff? If maybe they can't afford a therapist, the therapist isn't covered.
Yeah.
What are your go-to things?
Yeah. So what I will say is that in my experience, and this is again the world according to Mark, but if we had 100 people with diabetes, there are probably 2 people who need to see a therapist. And then there's another 97 or 98 people who need something, but that's not necessarily a therapist. They need some sort of mental health support. I think those things kind of fall into 3 different categories. The first is social support and peer support. So I always recommend organizations like Connected Emotion, Friends for Life, and Children with Diabetes, and TCOID as ways for people to connect with other people with diabetes and really see what other people are experiencing and normalizing people's experiences, but also really empowering people, because seeing other people with diabetes living lives that are not without barriers put in place by diabetes can be really, really powerful. I'm a big fan of books. I know there's a great one by some guy named, I forget his name, Adam Brown, Bright Spots and Landmines, that I recommend to everybody. Actually, I think it's right here. It's actually holding my computer up, so I'm I'm at level. And also Diabetes Burnout is a great book by Dr. Polonsky. It's a great book that I recommend. And then, of course, I think there's lots of web resources out there. So Diatribe is a great option. Beyond Type 1 is a great option. And I'm actually in the process of developing a new website called the Diabetes Psychologist, which is going to have a lot of resources for people with diabetes around the mental health aspects of diabetes. Not up yet, but hopefully will be up in the next couple of months. So I will be recommending I recommend all of those things. But I think there's lots of resources out there that are great and that can really provide a lot of helpful tools that don't require therapy, because certainly I think everyone could benefit from therapy, but not everybody needs therapy, and it's not the best use of time or money for most people with diabetes.
Awesome. Well, Mark, any parting thoughts, wisdom for people to take away in this maddening time?
I think that stay mindful and really know that your experience is normal right now. I think that people are always looking for solutions, and I think that sometimes we take this problem mindset to mental health challenges. If I have this problem and I need to get rid of this problem. And I think that for a lot of times that's a really effective strategy, but there are lots of also times when that strategy is not particularly effective because these challenges around diabetes or just around our times aren't things that we can solve. And so looking at it from a place of acceptance and a place of how do I deal with things how do I deal with things now and deal with them effectively, even if I can't make them go away, is a really is a great way, is a winning strategy, because we want to set you up for success. And if you can solve the problem with what's going on for you, then that's success. But if you can't solve the problem, or if the problem is not solvable, we've got to have a different metric for success. And I think there's ways to do that that we've talked about today, and that we can certainly that we can post resources on for folks. And that's both for providers as well as for patients.
Right on. I like that closing note. So everybody, tidepool.org/telemedicine. If you have any questions about anything else that we've covered, or you want to get started using Tidepool as a potential resource to view your patient's data remotely, we can certainly help you out. And again, support@tidepool.org is email, just if you have any questions about this or anything else related to your Tidepool experience. So that is it for us here in this Tidepool for Telemedicine webinar. Dr. Heyman, thank you. Adam, thank you for steering the ship. I'll see you in 2 days. Everybody else, be safe, take care, keep up the fight. Have a good day.